Can cortisol levels cause thyroid hair loss? Have you ever wondered if stress could be affecting your hair? Specifically, can high cortisol levels lead to hair loss related to thyroid issues? Let's explore this connection. Cortisol is known as the body's primary stress hormone. When cortisol levels are high, often due to chronic stress, it can disrupt the normal hair growth cycle. This disruption can lead to hair loss, but it is important to clarify that cortisol does not directly cause hair loss classified as thyroid hair loss. Instead, the relationship between cortisol and thyroid-related hair loss is more complex. High cortisol levels can lead to a type of hair loss known as telogen effluvium. In this condition, hair prematurely shifts from the growth phase to the resting phase, resulting in increased shedding after a few months. This happens because cortisol triggers the releases of pro-inflammatory cytokines, which interfere with the normal progression of the hair cycle. Additionally, cortisol affects hair follicle stem cells, slowing hair growth and increasing shedding. The hormone corticotropin-releasing hormone, part of the stress response, also plays a role. It can inhibit hair growth by shortening the growth phase and reducing the proliferation of keratinocytes, which are essential for hair formation. Fortunately, these effects are often reversible. By managing stress and normalizing cortisol levels, individuals may see improvements in hair growth. Now let's talk about thyroid hormones. Imbalances in thyroid hormones, such as hypothyroidism and hyperthyroidism, can directly impact hair follicle cycling. Hypothyroidism can shorten the growth phase and increase the resting phase, leading to diffuse thinning and hair loss. On the other hand, hyperthyroidism can accelerate the hair cycle, causing premature shedding and thinning. Thyroid receptors are present on hair follicle cells, indicating that thyroid hormones directly regulate hair growth. So, how do cortisol and thyroid-related hair loss interact? Chronic stress and elevated cortisol can worsen hair loss in individuals with thyroid disorders. Both cortisol and thyroid hormone imbalances affect the hair follicle environment, but they do so through different mechanisms. Cortisol primarily disrupts hair growth through stress and inflammatory pathways, while thyroid hormones regulate hair growth phases metabolically. For those dealing with thyroid hair loss, managing stress and cortisol levels can support healthier hair growth. This can reduce inflammation and help normalize hair cycle transitions. However, it is essential to treat any underlying thyroid imbalances to effectively address thyroid-related hair loss. A holistic approach is often beneficial. This includes medical management of thyroid hormones, stress reduction techniques, and supportive hair care. By addressing both cortisol levels and thyroid hormone imbalances, individuals can improve their outcomes related to thyroid hair loss. In summary, while high cortisol levels can contribute to hair loss by disrupting hair follicle function and hair cycle regulation, they are not the direct cause of thyroid hair loss. Effective management of stress and thyroid hormone levels is crucial for those experiencing hair loss related to thyroid disorders. Always consult with healthcare professionals for personalized advice and treatment options tailored to your specific needs.